I'll be 10 years post hemorrhagic stroke in February. Can I overcome learned non-use in my affected arm and hand? This is a great question. And most of the people, I try and address this in a lot of my videos because I know there's a lot of you that watch my videos on YouTube that are in that kind of 10-year range, 5 to 10-year range. So first, what is learned non-use? Learned non-use is basically simplified. When you have damage to one side of the brain, you wake up, you're trying to move your arm for the first time after you have that damage to one side of your brain. You try and move the opposite arm because remember, one side of the brain controls the opposite arm. You try and move the arm and the arm doesn't move. So the brain is very adaptive and the brain quickly, well, I'm talking as if the brain is like its own conscious being, which it really isn't, but your adaptive reaction or response to that lack of movement, you try and move the arm that's not working, it doesn't move. Your brain is going to adapt and find other ways to move that arm. One way that it does that is you just figure out how to do things with your uninvolved arm. That's kind of the beginning of what we call like learned non-use. Now, if that keeps going and you continue to use your arm that is not impacted by the stroke, what I always term the uninvolved arm, there are two things that happen right after a stroke. You get what we call sprouting, where healthy nerves will kind of start to sprout. This is simplified, kind of start to sprout new legs. So that's one adaptive strategy that the brain does. It tries to compensate or make up for a damaged nerve by taking a healthy nerve and having it sprout new legs. Okay, that's extremely simplified, but that's kind of the premise. Now, there's two ways that we can make this happen. One is that what happens if you use the uninvolved arm, what we know happens is that neurons on the healthy side of the brain will sprout legs and spring on over those legs to the injured side. So now what you're basically doing is you're strengthening the undamaged side of the brain. The undamaged side of the brain is now starting to kind of help out the injured side. Now, what this looks like clinically that I see is that someone will be trying really hard to use an involved arm and their uninvolved hand is doing it and they don't even realize they're doing it. That's what I think is I think that's the mechanistic explanation of what I see clinically. Not positive about that, but it's very common. They don't even realize that they're trying to move this arm and it's their uninvolved arm that is moving. Okay, so ideally what we want in that ripe time after a stroke, which is in that 6 to 18 months after a stroke, when the brain is the most receptive to this neuroplastic, this rewiring to occur, is we want what we call intra-lesional sprouting or intrahemispheric sprouting. That's when neurons on the damaged side of the brain, very close to the damaged area that are maybe healthy, those neurons kind of sprout legs to help out those damaged areas. And that occurs when we force use of the involved hand. So compensatory strategies probably lead more to that interlesional or interhemispheric sprouting, where you get healthy nerves on the healthy side of the brain sprouting over and helping the injured side of the brain. What would be more ideal is to get neurons on the damaged side of the brain to kind of sprout and help out. Now, the reason I explain all that is because learned non-use kind of incorporates what we call that interhemispheric sprouting, where neurons are sprouting legs from the healthy side of the brain over to the damaged side of the brain. Now, if you get a lot of that in the first year, we know that after the first kind of like 18 months, it becomes a little bit harder to get that rewiring. Your brain, right after an injury, just because of a lot of the chemical reactions that occur due to the damage, that's when your brain is the most ripe. So that's when we really see a lot of that learned non-use happen. That's when you really want to capitalize on forcing the involved side to work. Now, why do I explain all that? Because a lot of you, these are new concepts to you and you're way down the road because no one's explained these things to you ever before. And to that, I would say, so if you are like 10 years post, okay, and you have been compensating for a long time, there is nothing in my world and in my 22 years of experience that says that if you force use of your involved side, that you cannot undo a little of that. Now, the opposite kind of path that you can go down is that you don't do anything and you continue to compensate. And that's also a strategy. What's probably going to happen is over time, your involved side is just going to end up being less effective. If you have spasticity, your spasticity is going to get even worse. Your uninvolved side, you develop a lot of pain, overuse type of injuries and pain, things like that. So why do I say all that? Even if you are 10 years post, and maybe this is new to you and you've been compensating for 10 years, I still think wholeheartedly that there is value in continuing to have the mindset that you are going to learn how to use that involved arm. Now, is it frustrating? Yes. Are you going to feel like you're fighting an uphill battle? Absolutely. But I still think you will be better off down the road. So for all of you that are in that phase, I know that that's a very long answer to a very short question, but I would not stop trying to force use of your involved side. Now, what I've talked a lot about in the videos is that maybe when you get like 5 or 8 years post injury, you're not devoting 2 hours a day to that, because you have a life and I want you to enjoy your life. And of course you want to enjoy your life, and that's no quality of life to be spending 3-4 hours a day doing that forced use. But could you devote 30 minutes a day or an hour a day to just making sure that you're continuing to attend to that arm and trying to get it to work? And yes, I have seen people that for various reasons went back to living compensated because they either had kids or they had to return to a job, and now they're 10, 15 years post and they're reaching out to me or they're coming and working with me because they're starting to have pain, they're retired, they have more time, and I've seen progress. Absolutely. So that's why I say that don't ever give up. You can do it. Is it going to get back to normal if you've been compensating for 10 years? Probably not, but will you prevent it from getting worse and set yourself up the best way possible to be mobile as possible into late adulthood and retirement? Absolutely. So keep doing it. So hopefully that answered your question. Today's video sponsor is the Allele 3X percussion massage gun. Now, as you guys know, I'll usually only work with a company or a product that I think is going to be of value to you. And I think a percussion gun is one of those things. Now, I do get this question a lot. Should I use a percussion gun for my spasticity? And I would say it all depends. Some people just have told me that it definitely helps, but there's also others where I know for sure that it does make the spasticity worse. The only way to know is to try it out for yourself. Some of the benefits of kind of that percussion or that vibration on a muscle, I think, is that you can kind of desensitize that muscle to a lot of times what I talk about is that quick stretch, which is a lot of times what makes spasticity a little bit worse. So I think that's one of the benefits of it, and just tolerance to lengthening. So a lot of times it's that muscle lengthening that causes that involuntary contraction. And I think that a massage gun is a potential tool that might help to increase, again, that tolerance for muscle lengthening. But where I think a massage gun can be extremely valuable to someone who is recovering from a neurologic injury is in that very, very early stage where a muscle is flaccid. We know for a fact that just tapping and vibration helps to give sensory input to the brain. So if you are someone who lacks awareness of a limb, an arm, or a leg, that is where a percussion type of tool can be such a valuable addition to your toolkit, again, to build that awareness. And so this product I'm holding here is called the Allele 3X percussion massage gun. It is one of the more reasonably priced massage guns that are on Amazon. This model right here is extremely lightweight. It comes with 4 different attachments that you can put on the end. I really like the flat attachment. I find it to be the most tolerable. And it has this angled handle on it, which does make it easier to reach some of those hard to reach areas of your body. This gun is extremely lightweight, it's quiet, and it is pretty powerful. So there's 4 different settings. So that's kind of the lowest setting. And then as you go up in settings, that frequency of the pulse increases. So to get started, I would just start on a very low setting, and then as you build up the tolerance for it, if you're trying to work on activating a muscle or even decreasing the spasticity, I would always start on the lowest setting, work your tolerance up to the higher and higher settings. But as usual, this company was generous enough to support this channel. So by clicking on the link, you can learn more about the product, but it also does support this channel. So thank you in advance for your support. To learn more about this product and to purchase it, click on the link in the description below. That video and you want to learn more exercises on how to improve your walking, definitely check out this video over here or that video over there. If you want even more help, check out our gold membership program where you'll get access to over 300 exercises that are not here on YouTube, as well as access to our monthly lives where you can get your questions answered.